Well, I was in a motor vehicle accident October 28th, 2012. I had multiple injuries and I had a brachial plexus injury. It was probably one of the scariest moments of my life when I found out that my arm wouldn't move.
Let's go ahead and let me just check your nerve function first. She could not move her shoulder at all. It was completely limp shoulder. She could not bend her elbow at all. She had weak elbow extension and she had a weak hand.
Before the accident, I never ever heard of a brachial plexus injury until I actually went to Dr. Lee and Dr. Wolf. I didn't really know much about it until they explained it to me, and they were really well at explaining it.
The best way to describe the brachial plexus is the electrical power grid of the upper extremity. It's where all the nerves mix and match to create the peripheral nerves of the hand and limb.
My activity level before the accident was outstanding. I was running every day. I was on the track team, soccer team, I danced.
When she first presented, she was devastated. Young, healthy woman who was very active before, and now she has a paralyzed limb. Again, and do it really hard. Wow, look at that muscle here.
Right?
Yeah.
Thank you. The progression of my arm, I couldn't move it at all. It had atrophy, it went in. You could see my muscles and my bones popping out.
So we did a number of nerve transfers. So that's where you take nerves that do something else and bring them over to gain function that you want.
But I couldn't really feel. My sensation was gone. I couldn't feel anything. You could touch me, I couldn't feel it. You could burn me with a curling iron, which happened, and I didn't even know until I looked in the mirror.
She has just done, amazingly well. She's got recovery back. Those muscles are very strong. She's back to weightlifting. At this point, when you see her and she talks about people not even noticing that she had a problem before.
The past 3 months, I've seen the most recovery in my shoulder than I ever have. And now I can go like this. And soon enough, I know I will be able to put my hand to the ceiling. I know it. Could do everything. After my accident and my recovery, my career path changed because all I want to do is live and breathe occupational therapy. I want to be an occupational therapist.
There really is no more gratifying feeling than seeing a patient lift their arm up again. It's very powerful, actually.